So this is your stock Neodent GM unguided kit. This is how it comes in. All your drills, plus drills, implant carrier, torque short, torque long, driver, and extender. I am not a big fan of this kit. I have really made my own custom kit. But there are a few things that I really liked about this old kit, and I use that as a non-guided version. The first thing that I always do is that I use a 2.0 drill from the guided system. So this is your regular 2.0 pilot. This is your first drill. This is your pilot. The reason why I like my second drill as a guided pilot drill is because more than often, if you've done enough implants, you know that you need to use something like this for your pilots, which is your drill extender. And you place the pilot in the drill extender. In my hands, and no matter how good this connection is, there is always a little deviation, slight. You can even see that wobble here in this. It's very slight. This little wobble in my hands, I've had some trouble with it. I've had it slip out of the osteotomy and I don't like it. So in order to make my life easy, I still keep this because again, if I have a patient with limited mouth opening or I don't need to use an extender, I still keep it. I call it my backup pilot. And these markings, I'll take a burr and just carve out the markings on my extended. I call it the extended pilot. Again, it's a guided pilot. I call it the extended pilot. Because there is no connection, it's one longer drill. Of course, you won't have any wobble, fits into the handpiece. For me, this is the most critical part. Is because once you have the perfect osteotomy placement in your pilot, all the rest of the drills follow through. Especially important when you're doing extractions and immediate implants. So if you do extractions, immediate implants, having this guy in the right place can make it or break it. But this one drill can make a difference. Again, I encourage, try it out. And if you're using this sort of connection, you can see how long this is. Now imagine doing this sort of connection in a restricted mouth opening, but you have a long rooted premolar. This is your go-to tool. Try it out. It'll make a big difference. Now the next thing that I really don't like, and I change it right away, is this guy. This is an implant carrier. More than often when you pick up the implant, put the driver, trying to put that implant in, I find more than often times that it stops because the handpiece is interfering with adjacent teeth. So you're going in, implant stops because again the handpiece stops. What do? You take it out. Now you go to this guy or you go to this guy. I picked this guy. I like this guy. It's the perfect example of how you can really get the implant right through your handpiece driver without using the torque wrench, because it's a perfect length. As a backup, let's say if I'm doing a premolar, sometimes even this can become too wide and I can have interference in the adjacent teeth. So I always carry the narrow guided one. This is a very good length for all your unguided surgical implant placement. This goes in. I keep the regular size torque driver in it, but again my to-go size, and I pick the narrow one and I take this as my torque driver and I place it in. This just gives me a lot more visual visibility as compared to any of these ones. So a few subtle changes in the Neodent system can go a long way, and trust me. But this is my custom Neodent Grand Morse unguided system and it works really well in my hands.